Welcome to the Pretty Powerful Podcast, where powerful women are interviewed every week to share real inspiring stories and incredible insight to help women or anyone break the barriers, be a part of innovation, shatter the glass ceiling, and dominate to the top of their sport, industry, or life's mission. Join us as we celebrate exceptional women and step into our power. And now, here's your host, Angela Gennari.
Hello, and welcome to another episode of the Pretty Powerful Podcast. My name is Angela Gennari, and today I'm here with Kyra Valdez-Shipp. Hi, Kyra.
Hi, how are you?
I am so good. Thank you so much for joining me today.
Yeah, thank you for having me. I'm excited to be here.
So Kyra is joining us, and she is the founder and CEO of Peak Performance Consulting. So what made you want to get into consulting?
Oh gosh, well, it's not new to me. I feel like I've been informally consulting for a long time, but I actually got into consulting just purely from the need. I was constantly being outreached to by people within my industry at the time and giving away advice. And I kind of had some barriers because I was employed and couldn't give away all the secret sauces and all of my intel. And so I decided to make a big leap of faith and go into consulting and really be able to break away from the box and help businesses in a way that I was just really unable to do before.
I love it. That's such a great reason to get into consulting, to help people and to just make sure that you can share the information and knowledge you've gained. That's awesome. And your previous role was in healthcare. Is that right?
Yes. So I'm actually a nurse by trade. I started my career as an ICU nurse. I'm a little bit of a adrenaline addict, if you will.
Okay. And you have to be an ICU, I would imagine.
You have to be. So I kind of made my way over into what a lot of people consider the dark side of health insurance. And I spent almost 2 decades working on the health insurance side for 2 Fortune 25 companies and learned a lot along the way about business, about healthcare, about leadership, all of the above. And then over time, kind of made my way into where I am now.
Very nice. So what specifically do you consult on? Is it mostly health insurance?
I have 2 different sides of my business, if you will. So we do business consulting still in the healthcare space. So in our healthcare unit, we work with the health insurance companies. We work with provider systems, as well as we work with vendors that support providers and health insurance companies, really with the goal of streamlining and making the healthcare system work better. As anybody would probably agree, the US has a fragmented system. It's not a bad system, I can tell you. I have been in the depths of it for 2 decades, but there's still a lot of opportunities. So what my firm does is work with those partners to try to strengthen collaboration, communication, and at the end of the day, really take care of the patient. And then we have our other, if you will, side of the company where we do business consulting. And my firm, what we have learned is some of the best secret sauces, if you will, of the top Fortune companies. And what we believe in is that every business has the same need and the same issues of a Fortune 500 company. The difference is just simply scale. And so we work with businesses from younger folks just starting out and getting an LLC and going for their dream to, mid-sized businesses who have been in business for 25 plus years and all the way up to still some of those Fortune 500 companies. So really our foundation is business consulting. And then of course we have that specialized niche in healthcare.
Very cool. I love that. So yeah, I think there's a lot of room for people to just get general business knowledge, but I think healthcare is one of those realms where it just feels so complicated.
It is
very tough to navigate. I mean, and I can tell you, even as a small business owner, one of the most challenging tasks that I've had over the past year was trying to find great health insurance for my team. And, it is trying to figure out the, ACA reporting rules, trying to make sure I've got a good policy in place, trying to make sure the deductible isn't too high, but yet the premium isn't too high. And so it's a balancing act, and it's a very tough space to navigate.
It is a balancing act. And I will tell you, you just mentioned something like a policy in place.
Yes. Yeah.
I index heavily on like following a system and a routine, but especially with healthcare, what I think that I would like to say that I love about our healthcare system and where it's come from, even, 15, 20 years ago, is that there's an opportunity for everybody to have coverage now.
Mhm.
And we have a long ways to go on, pricing and options. And we have a shortage of nurses and physicians and things, but people are no longer in a position where they can't have coverage. And
Yeah.
that's super important. So yeah, I think that I'm really inspired by what the healthcare system is doing, including the insurance companies, and what they're doing behind the scenes to try to make it better for all and to try to expand.
So I'm just curious to know your thoughts on our healthcare system as compared to somebody like the UK or Canada, or someone with kind of that nationwide coverage of, the government controls the healthcare. Because I've heard horror stories, and then I've heard good, and so I'm curious to know your thoughts being from that industry.
Yeah. I mean, I think that there's pros and cons to everything, right?
Mhm.
I don't specialize in understanding their systems and how they function, but I
Mhm.
think there's pros and cons. And I think that a good way to kind of look at it too is, even if you think of in the US, if you look at a state, you have rural and you have metro, and
Mhm.
you have to solution at the local level. And, I shared with you that I'm actually in Nevada right now, in Vegas,
Yeah.
at a conference to
Yeah.
present. And here you have your extremely metro and your extremely rural areas. And
Mm.
those two populations, even in the same state, have different needs and different requirements. So I can't say that I think that, Canada or the UK or anybody who has that type of a structure is better or worse. I think that there's pros and cons to everything. Um,
Mhm.
I think that where we're at least in the US, is really just trying to be able to make sure that people have access, which is a similar issue that other countries have. You hear, to your point, horror stories about, waiting 6 months for a surgery. Well,
Yeah.
that's an access issue. Access issues uh, don't care where you live or what kind of system you're in. It's about how do we get, nurses and physicians education and inspire them to go into the field and inspire them to be in places like a rural setting where there's care needed. So, yeah, to
Mhm.
answer your question, I mean, I think that there's pros and cons about everything. The way that I approach business, healthcare specifically, but any business, is really just looking at like, what is the problem and how do you solution for that? How do
Yeah.
you set up systems and processes and strategic goals to try to make that at one point issue no longer a problem?
Mhm. And where do you see healthcare being more streamlined? Like, how do you see that being effective for the average user? You have somebody like me, who I rarely ever go to the doctor. I am in my mid-40s, healthy, workout, I'm generally pretty healthy. I rarely ever go to the doctor, but when I do, one of my frustrations is I don't want to wait. And I don't want it to be a day trip. Like, I want it to just be in and out and gone. And but yeah, so how do you see streamlining happening in the healthcare world?
So, well, first of all, don't tell me that, because I'm going to tell you, okay, for your age, even though you're healthy, you need to go get this screening and this
Yes,
screening
yeah,
and
yeah.
this.
Oh,
And
I have all the screenings. I do all the screenings. I'm just not somebody who I'm pretty healthy. I don't, thankfully, thank God I don't have to go to the doctor a whole lot. But
yeah.
yes.
Yeah, no, so for streamlining, I think at a very high level, we're seeing more of like local and federal regulators coming together on, how they coordinate and
Mhm.
how they're building out policies and guidelines for practice at all the different levels with all the different payers. But one thing that COVID has really changed is how we look at care. And so telehealth is huge, and it's getting bigger, and we're starting to, think more strategically about how can we deliver care where the member is, meeting the member where they are. So, for example, right? If you do wake up and you're not feeling great, like telehealth is a great option, and the insurance companies are providing that as a benefit. So yeah, I think that just trying to lean into that, and then really trying to, what we've seen over the last several years is having more partnerships,
Yeah.
where the insurance companies and the providers are working together more collaboratively. And, they're rated and they're judged off of member feedback and wait times and things like that. So just having more focus on those types of things, I think,
Yeah.
is a path in the right direction.
And I agree. Telehealth, I'm a huge fan of telehealth. I think that it is the equalizer. I think it has opened up good healthcare for people all around the country, no matter what your demographic or where you live. And I think that that's been a huge blessing for everybody, because honestly, like, if you live in a rural area an hour away from a hospital, for you to just go get, basic care, on things that, you may just need a prescription renewal. You need something simple, but you've got to drive all the way into the doctor, which could mean you have to take off of work or find childcare, find gas money, find transportation. Like, there are so many obstacles in just meeting a basic need. And I think telehealth has really solved a lot of that. And I think that has been one of the best things to come out of healthcare in the decades.
Yeah, and you mentioned something that's really exciting too, that a lot of the general public don't realize, but behind the scenes, they are really focusing on exactly what you said, is like, outside of just a disease and I need
Mm-hmm.
medication, what are people challenged with every day?
Yeah.
And insurance companies are coming up with new and creative ways to support members who lack transportation or can't afford food.
Mm-hmm.
And they're offering benefits and support, like something that we've never even thought of or seen before, to help people to have their basic needs taken care of. Because if somebody doesn't have basic needs taken care of, they're not thinking about their health.
That's right. So what do you think are because so as a small business, we're trying to find ways that we can support our employees, and we have a lot of part-time employees. And
Yeah.
so we have found ways that we can support them by offering, because, like, in my opinion, it's not just your physical health that matters, it's your mental health, it's your financial health, it's, nutrition. So these are things that I think move the needle in making you a good whole healthy person. And
Yeah.
so, but you don't see insurance companies get onto the, idea of mental health as being something that is as critical as physical health. And same thing with nutrition. They're not pushing nutrition as much as they are prescriptions. Like, I would much rather have good nutrition versus lots of prescriptions in my diet, right? So
Yeah.
how do we get insurance companies to understand the value of mental health and nutrition as it relates to physical health?
Yeah, so the good news I can tell you, having
Yeah,
had insight to a lot of the big payers that you think of, and even local ones, is that they are thinking about that.
good.
And there's even kind of a phrase that we talk about in the industry as food is medicine.
Yes.
And they are thinking about behavioral health more and understanding that holistic care. It
Hmm.
is happening, it is being
Good.
looked at, there is investment occurring. It takes a long time to shift that. And some of these problems are very difficult to solve.
Hmm.
Behavioral health concerns in the population, that's a tough thing to figure out. So they're getting creative. There is investment, there is focus, there is measurement of success that even the federal government looks at for the health insurance companies to say, how are you managing these populations? I think
Yeah.
we just have a long way to go, but it is there, and all of them are definitely focused on it. And that is definitely a huge shift from the old health insurance companies that I think a lot of us still kind of have that thought in our head.
Absolutely. Well, and that's one thing that I feel like is going to be the game changer in the industry, because, there's phrases and books, and, the body keeps the score. And I can tell you, during the most stressful times of my life have also been where, even once I come through the stress of it, I become really sick. And I think that just
Yes.
becomes, it's like your body just says enough and I can't take this anymore. And then all of a sudden you're in bed for 3 days with,
Yes.
and so like that, it really does impact it. So that stress and that mental health does have a role to play in your physical body, and as does mental, like if you are depressed, you're not eating well, you're not sleeping well, there's so much that just correlates. And I feel like in order to really make a person healthy, you have to take care of all of that. It has to be nutrition, it has to be mental health, it has to be, all of that together. So
Yes. Yeah. Yeah. No, and I like what you said, even to, as a business owner, you think about that for your people and for you, right? Self-preservation. And I think that that's something really important that people don't index heavily enough on is how do you take care of yourself?
Yes.
How do you take care of your people? How do you still hold people to a high standard while having that balancing act of leadership and, being a servant leader and being, somebody that's approachable. And, when you are a business owner and you are the CEO, you have all of that to think about. But I think that, the success as a leader and as a business owner is that when you are rooted in, the health of yourself and prioritizing yourself first, even above everything else. And when you show up, that is key for your team and, who's following you and just being that leader for success.
Absolutely. So where do you see the healthcare industry going?
That's broad.
It's very broad, but do you see it still maintaining that same, the kind of like the big three, big four insurance companies kind of running everything? And I see a lot of hospitals are merging. Like there's a lot of hospitals that are like the smaller community hospitals are being bought by systems. Now they're all part of a system. And that system has mandates, on certain things. So, and I guess where I was going with this is the more we institutionalize things, like we take all of our community hospitals that, they had a CEO who is in touch with their community, and now they're part of a broad program. There's benefits to having that, but then there's also negatives where they're losing that community feel. They're losing that ability to make decisions on their own because now there's policies in place that are company wide that, this is the way it's going to be because this is the policy of this particular hospital group, right? And so no longer is it XYZ community hospital, but you're part of this broader program and we have to follow all their rules. We can't make decisions on site anymore. So do you see that becoming more or less? Do you think that that's getting traction and that there's benefit to it, or do you think it's going the wrong way?
Yeah. So, more or less, I think the answer is it depends. But what I will tell you is this. So if you take a step back, those health systems, the providers, the community health networks, all of them have the same regulatory body. Right. All of them have to follow the same rules. Where I see, and I have seen this, and I've been hand in hand with physician groups and systems for, 15 years now, is that the benefit to it is systems. Right. So they all have the same guiding principles. They all have the same rules. But what you will find is that the reason that these buyouts are occurring and why they are successful is that the systems, they have everything in place. They have the policies, the people, the programs, the quality improvement, the data, the partnerships with vendors. They have it all in place for good, positive patient outcomes. Now, am I saying that that's always going to be every single person walks out of the hospital healthy and has a great outcome? No, that's called life. But what I can tell you in looking at the data, and again, they all are measured the same way, is that those big health systems, they show positive patient improvement in chronic conditions, in hospital readmissions, in every aspect of care. They've set up structures that work. And so I think that the reason why a lot of some of what you would call like the smaller providers or the mom and doc shops are going to this is because they don't have the infrastructure to support the patients the way that they need to, or maybe the funds to put that together. And again, when they're all on the same playing field of having the same rules and regulations, which are good rules and regulations, they need to have that infrastructure. So I think that is why you're seeing a lot of that. And to answer your question of does it work? It absolutely does. Is there always work to be done? 100%.
Yeah.
And my area of focus in healthcare, specifically with the payers, was always quality improvement. And I think that all of them have that continuous improvement mindset on. And so with that, I mean, it's only going to continue to get better. But does it work? Yeah. And is the data and the outcome showing it? Yes.
Awesome. So healthcare seems to be one of the most stable, growth-oriented industries. If you are a nurse, you have a very, very good career ahead of you. Why is it so difficult lately, and why are we seeing such an exodus? And I know that a lot of the exodus came after COVID because people were just tired. They were just exhausted, and they had been overworked so much that they just couldn't take it anymore. And I've seen so many people who are in healthcare leave the industry altogether. But how do we get people back into healthcare? How do we start recruiting and making that the attractive position it used to be? Because now so much of it has now become traveling doctors and traveling nurses because they're so short staffed, they just kind of bounce from place to place. How do we make it a career that people want to go into?
Yeah. Well, goodness, you start at the root of it, which is all of these people have to be highly educated individuals.
Right.
And, if you look at just focusing on the education piece, it costs a lot of money to go to nursing school, to med school. They're constantly requiring higher levels of education of nurses. Associate's degree used to be good for any type of nursing.
Right.
Now they're like, no, you need a master's, a PhD, this or that. So education is expensive, takes a long time. It's very competitive to get into. Now, I will say, I don't know if this fact is accurate, but I have a friend who her daughter just got accepted into med school. She's proud mama, but she was saying it's so hard because the acceptance rate, again, not my quote, but she said is like anywhere from 5 to 10%. And I'm like, really? I don't study this, but maybe that's a contributing factor. And I actually go look that up now. But it's hard to get in. It's expensive. And then the other thing is they hold you to a really high standard. So I can tell you, many moons ago when I was in nursing school, we always had this joke that C equaled degree. But, the standard scale system, you could not get below a 76%. And in most, educational systems, a 76 is still a C. Well, a 76 was actually bad, and a 75 you failed. And then in nursing school, you could only fail 2 classes and you were out, you were done.
Wow.
So it's difficult. And I like the fact that they have that, because you have
I don't want people who don't know what they're doing working on me. Yeah, it makes sense. Yeah.
But you have people's lives in your hand, but it's so hard and it's expensive. So, there's that. But then when you look at what the healthcare system is, the people working in it are challenged with. I mean, like I said, it's been many moons ago since I was in the ICU, but between family, between environment, between short staffing, high ratios, multiple shifts, odd hours, it's a lot of toll on the body, and it is mentally draining. It really is. So it's that's a tough one to solve. But I think that, from an education standpoint, if we can have more money funded to support these people who are brilliant, that want to do it and maybe can't afford, number one. And number two, really looking at how do we balance those people that are bedside so that they don't have the burnout, and how are they properly compensated, because many of them still are not.
Yeah, that makes sense. Very cool. So what obstacles, so kind of pivoting out of healthcare and going into opening your own business, what obstacles did you have to overcome in starting your own company?
Well, like everybody, you have the basics. How do you
Mm-hmm.
actually form a company?
Yep. Yeah.
But no, I've actually been in entrepreneurship or in the entrepreneurial world for several years. We had lots of real estate, bought and sold millions. I actually have multiple e-commerce platforms.
Nice.
I have a small med spa. I love my med spa, so I've been doing that for several years. But going into this huge transition, I think the biggest leap that I had to figure out is, how do you leave the corporate world that
Yeah.
I was well compensated and now
Yeah.
make that up and grow my own business? And
Yeah.
that's been the biggest challenge. But I will say the key to overcoming that has just been the fact that I've always invested in relationships
Yeah.
and making that transition and, calling upon people and saying, hey, I'm out here and I'm doing this new thing. It has just, the network has started blossoming. But there's always the little details,
Mm-hmm.
taxes, things like that. So you learn along the way. But I think the biggest thing I've had to overcome was simply fear.
Yeah.
Uh,
I
you know,
understand.
it takes a lot to make drastic changes in life. So
Well, and belief in yourself, that's one of the hardest things too, is when you start saying, I got the ability to do this, I can do this, I believe in myself. That's one of the hardest, scariest things
yep.
because it's, especially if you've collected a paycheck for a long time, that leaving that comfort zone, leaving that safe space to go in and just have only you to depend on can be very daunting.
It can be
So
daunting and also empowering
yeah,
because
absolutely.
you are the one who makes you succeed or makes you
Yeah.
fail. So,
Absolutely. Yeah,
you
yeah.
look in the mirror at night and decide, am I failing or am I successful? And if you're not successful, well, you better get it in gear.
That's right. There's no one to blame but you. No fingers to point at. Yeah. So yeah,
Yep.
I agree. So kind of going a little bit back into healthcare, um, as a nurse, what was, I guess, what was the part of it that you loved the most? And then what part of it made you say, I think I'm ready for a new challenge?
As a bedside nurse,
Yes. Mm-hmm.
um, well, I loved the most. So, growing up, I had some health issues and
Okay.
I actually had some really terrible experiences.
Oh,
And that's what actually drove me to say, you know what, I think I want to get into the medical field because I said nobody should ever have to feel this way or have the experience that I had. And I want to go in and be a game changer with people that, are in the hospital or having something going on with them. So that's what
yeah.
drove me. And I think what I loved about it is, interestingly enough, in the ICU, the patients don't really know you're there because, they're in the ICU and they're usually
Yeah, that's
sleeping,
true. Yeah.
but their families are. And what I discovered in bedside nursing in the ICU is that I got to help those families in times of extreme need, in times that nobody wants to be in, and
Right.
just being that support that can give them the bits of knowledge that they need and just be there with them and keep that space was really, really fulfilling.
Yeah.
I think what made me want to transition to essentially the health insurance company was, I actually worked at a hospital that was just low income, demographic, really struggled, similar to our conversation earlier. Like they had other needs that were not being met. And they came in, no pun intended, on their deathbed. And at that
Mm,
point, there wasn't a lot that we could do. And there was a lot of mortality. And I just said, there's got to be a way that I can take this passion and help people before they make it to the ICU bed. And
yeah.
so when I originally transitioned over, I was a nurse on the phone calling people and talking to them and, coaching them and working them through whatever was going on with their health. And I loved it because I was like, I went from having one patient who was really struggling, maybe not going to make it, to having 50 that I talked to, and I could see their progress and they were improving and getting healthier.
Yeah.
And what I loved about the industry that I was in and, my career in health insurance is that I went from having, that 50 patients as a nurse to working for a company that we had 20 million patients, and I was head over quality for the entire company. And I always said, these people will never know me, but I have 20 million patients that I'm helping
Wow.
them and putting things in place that can help them improve. So that was kind of, what got me into healthcare, my own experiences, and then what ultimately pivoted me to say, I need to go a different route and help more people.
Wow, I love it. Yeah. And that similar way of wanting to help people and make a difference in their lives is probably what brought you into the consulting world.
Yes, absolutely.
Very cool. So what advice would you give to your 18-year-old self?
Oh, that's a good one, because I was a very motivated 18-year-old.
Yeah, I imagine.
I would probably have told my 18-year-old self, you're dreaming too small.
Oh, really? Interesting. That's
Yeah.
great.
Yeah, I actually struggled. There was a point in my career where my 18-year-old self had set all these goals for me, and I met those goals. And there was about a 6 month to 12-month period of time where I looked in the mirror and I was like, what next? This was supposed to be your end game. This was supposed to be where you retired. This was your goal. And you already met it. Like, what is the rest of your career? What does your life look like? What are we going to do next? Are we going to sit here? Are we going to move? And that was a moment in my life and my career that I really struggled with, because I didn't think that big. So I think, understanding that, and now, as many years past 18, I continue to tell myself, don't put limits. Think bigger than what you're currently thinking, whatever it is, multiply by 10, because that's the possibility.
That's great. I love it. So I'm going to kind of circle back into the healthcare space just for just a moment. So one of the things that I think happens in the healthcare space, especially in the insurance, is the abuse of healthcare. And what I mean by that is people going into the ICU who aren't on their deathbed, who aren't in a severe condition, who are in there because they have a common cold, but they don't have the insurance to go to a doctor. So they're going to go to ICU where they have to have care, right? So you have situations like that, or you have situations where painkillers and opioids and things like that, are being given to people who, they say it's really tough for somebody to prove back pain, to prove that they're in pain. And so doctors will fill these prescriptions. And so, how do we stop the abuse of healthcare so that it is a little bit more reasonable? And it doesn't stop there. It's also the astronomically high lawsuits, right? I'm going to sue somebody for $10 million because I stubbed my toe, when I was doing, like, it's just crazy. So how do we get this under control? Do you have any idea on how we can possibly just kind of rein in the craziness?
Yeah, so I mean, I think that there's a lot of scenarios that you can look at. No, no two scenarios are the same, right?
Right.
But I would say, the first one that you talked about with like going to the ICU, all the hospitals and the system, they have protocols. And if somebody's in the ICU or if somebody gets admitted to the hospital, there's a reason. There's a
Right.
reason.
And then I don't mean ICU, I mean
Yeah.
emergency room.
Yeah.
Yeah.
I think that, there's access issues.
Mhm.
So if somebody doesn't know about telehealth and it's a weekend and their PCP doesn't have, a primary care physician doesn't have an on-call number, and they just don't know where to go, and they don't know if they have COVID or pneumonia or what have you, their situation, they're probably going to look up and say, is there an ER to go to?
Right.
Now, we know that ER probably wasn't best, but people may not have access to other options or may not know about them. So I think that the key is to continue to look at solving the problems and then educating the population. As far as the other things, like with prescriptions and drug abuse, it's a problem. It's an epidemic, and
do you think that's increased with telehealth when they don't have to go in and see a doctor and they can get a prescription renewed, or do you think it's the same?
No, telehealth is very different. And there's a lot of rules around telehealth and what you can prescribe and things like that.
Mhm.
There's a lot of stopgaps that are being put in place. And I will say that pharmaceutical companies are supporting this,
Good.
health insurance companies, providers themselves, the states, the state agencies, the federal government. It is a huge orchestration of effort to say, how do we communicate better together? How do
Yeah.
we put things in place to prevent it? For example, years ago, you used to be able to go and get an opioid filled, for example, at Walgreens and then CVS and then here and there.
Yeah.
And people figured that out and were able to go collect medication, unfortunately. And now there's a lot of different processes and technology in place to prevent those types of things. So it's a hard problem to solve, but again, what I think a lot of people don't realize is that behind the scenes, all of these companies are actually working together to say, how do we fix this? How do we use technology? How do we use AI? How do we use all these different tools in our tool belt to try to make this problem better?
Yeah. Yeah.
Yeah.
Very good. So, this has been an enjoyable conversation. One of the things that I always ask in my podcast is, can you tell me about a time that you gave your power away? And then another time that maybe you stepped into your power. And, one of the reasons is because as women, we often give our power away, whether it's somebody else gets credit, somebody's able to shut us down or, criticize us or do something to prevent us from standing in our power. And then is there another time that you've stood in your power?
Yeah, so I think I've given my power away a lot. And
Yeah.
I think that comes from how I grew up and being a young woman and trying to, navigate the world and figure it out on your own. Um, it really showed up at least early in my career when I wouldn't speak up after having a annual review where I had amazing results, the highest you possibly could, and
Yeah.
then was told, well, you're not getting a raise because you've only been in the position for 9 months,
Yeah.
things like that, which now I understand that doesn't work, and that's probably not what you should do for people. But just accepting those things, or accepting other people, you mentioned, taking a credibility for your work, so on and so forth. And I think that as I've grown as a person in my career, I now know my value,
Good.
whether it's financial or whether it's, this is what I offer to the table. So much so that I've had, I'm very bold, situations where I've told people that, hey, I'm nobody's second choice.
Good.
And, this is what I bring to the table. Either love it or hate it, take it or leave it. Sometimes that doesn't work with people, but I know my value and I know what I bring to the table. And so when I go out into the world, personally or professionally, that's what it is.
That's amazing. Keep doing that. Keep doing that. I tell people all the time, like, you have to understand your worth and your value and, come in with a mindset of they need me just as much as I need them.
Yeah.
So, yeah,
Yeah.
for sure. Well, this has been really, really enjoyable. I have so enjoyed this. And I just have one more question for you.
Yeah.
What do you wish more people knew?
Mm. New or realized? I'm going to take that how I want to take it.
Yeah.
Um, so I am actually a cancer survivor.
Oh,
And
wow.
the one thing about cancer that I heard it my whole life, but I never truly realized, is that tomorrow's not promised. And
Hmm.
so I think people say it a lot, but I don't think everybody lives it. And I think that if you can, in an optimistic way, truly realize that we only have this moment guaranteed, and if
Yeah.
you can make the best of that moment, then you're living your life to its fullest. And if tomorrow ends up being your last day, at least you went out with a bang.
Yes. Yes. Amen to that.
Yeah.
Well, thank you so much. So, how can people find you and Peak Performance?
Yeah, absolutely. Well, I do have a website for the consulting firm,
Okay.
and that is peak-psg.com. I
Okay.
think we'll link it for everybody to go to. And then you can also follow me on social, which is Kyra Shipp Official, KYRASHIPP Official. And definitely feel free to outreach to me if you have questions or follow along. Would love to engage with the community. And it's been so great to talk with you today, Angela.
Yeah, it's been a pleasure. I've enjoyed it. So, and we will make sure that Kyra's information is also on prettypowerfulpodcast.com. So you can look her up there as well. So thank you so much, Kyra. This has been a really enjoyable conversation.
Yes, likewise. Take care. Have a great day.
Thanks, you too. And we'll see you guys on another episode of the Pretty Powerful Podcast. Have a great day, everybody. Bye-bye.
Thank you for joining our guests on the Pretty Powerful Podcast. And we hope you've gained new insight and learned from exceptional women. Remember to subscribe or check out this and all episodes on prettypowerfulpodcast.com. Visit us next time, and until then, step into your own power.